Welcome back to Dentistry Explained. Today we're going to discuss what's a cavity and how do we get them. I am Dr. Jenny Perna. I am a dentist in South Florida with a focus in cosmetics, and my goal is to bring universal understanding of dental conditions to the world. I'm sure you've been to the dentist a time or two and they've told you to avoid candy around Halloween time and that donut in the break room and all of those really fun things that you really want to eat. I think it's pretty unrealistic to ask our patients not to have a delicious sweet treat every once in a while, but basically what they're telling you is to avoid those sugars, but not because of the sugar component. It's actually something else that's going to cause that cavity process. Let's get into the scientific what causes a cavity. Whenever we ingest something that's a carbohydrate, what's a carbohydrate? Well, that's going to be, yes, your candies, your donuts, your cakes, your sugars, but it's also going to be your cereals and your apples and your oranges and your fruits and your bagels. Any carbohydrate that gets ingested, the bacteria in our mouth is going to start to break it down. Whenever bacteria breaks down a carbohydrate, it produces what's called an acid. If you remember back from your basic sciences, acid is anything that's below a pH of 7. Now, when the mouth falls below a pH of 5.5, we'll start to see a breakdown of the outer surface of your tooth, or what's called your enamel. When your tooth is in that weakened state, bacteria is able to penetrate through that surface and start the cavity process. Now that we're talking about acids, let's think about, well, what else in our diets can be acidic? Well, it's gonna be your coffees and your teas and your red wines and also like orange juice. There's a lot of things in our diet that can be acidic. Even those great sparkling waters that you were drinking trying to be healthy. Yes, those are acidic too. So when we ingest acids as well, the pH in our mouth again can fall below that 5.5 level and we can see an increase in cavities as well. How do we enjoy snacks in moderation and carbohydrates in moderation without increasing the likelihood of getting cavities? One main thing is snacking. And we are all victim to snacking at certain times in our life. But when we are constantly snacking on something or even like sipping on your morning coffee from like 8 a.m. to 12 p.m., what basically happens is your mouth is in a constant state of acidity. Now, we have a really cool natural mechanism in our saliva. Our saliva is able to buffer the pH of our mouth up into the neutral zone where we don't see the breakdown of that enamel. But if we're constantly snacking and we have that constant acidic state and we have that constant breakdown of our enamel, our saliva can never catch up and it can never help buffer us back into a safe zone. So that's one really great tip if you want to figure out how do I have that cup of coffee and not give it up, but also not get as many cavities. So guys, that is how cavities are formed. It is from the bacteria in our mouth breaking down carbohydrates that therefore produce an acid that will break down our teeth. Thank you guys for tuning in for this episode of Dentistry Explained. I hope it was helpful and you can now understand the cavity process a little bit better. Please hit that subscribe button, like, and comment any topics that you would like to have discussed next.